from Stryker. I'm going to be doing an in-service on the Neptune this morning and also covering some smoke evac as well. It's a hot topic. It's a topic that I'm really passionate about because none of you should be breathing smoke ever in an OR. It's regulated in other states and it's regulated. Regulations come into New Jersey. It's been in Rhode Island for some surrounding states, but it will eventually be in New York. So I want to make sure you're educated on that. So I know you've been using the Neptune for a while. So this will be kind of a review, and hopefully you learn a little something new here. So just an overall picture here, the Neptune was designed by a nurse for nurses. So I don't know if you knew that, but it's geared to make your life easier in that sense. The main difference of this is it's a closed system rather than an open system in terms of canisters. So you have a 4-liter canister and a 20-liter canister. And the 4-liter canister actually has a light that's on this screen that you can put on. So in order to get suction, you would match up these large rivets into the large rivet hole, push in and turn clockwise. When that happens, you're going to see this eyebrow. This eyebrow is just to indicate that there's a manifold that's ready to go. And on the screen itself, it'll tell you if it's a new or used manifold. So it's 1 manifold per patient. In order to, let's see, if you were to apply suction, okay. So in order to apply suction, like I said, these are two canisters that are controlled completely individually. So you have your control for your 4-liter here and your control for your 20-liter. It's going to be consistent suction. So there's vacuum pumps in here that allow you to control that precision, unlike a canister that fills up and the suction changes as the volume increases. So, common issue. Let's say you put this on, you're maxed out, high suction, and nothing's happening. Nothing's going to happen until you push the button here and start suction. So when you start suction, the manifold register is used, so you know not to use that again. And when you're done, you can stop the suction there. Recommend to just put the suction level at the lowest needed, and you can scale up as needed. Again, you're going to get consistent suction. And you're also going to get a readout that says what your set limit is. So if you're set at 20, and you're going to have an actual readout of what that suction is. So it may be a little less depending on how many ports you use. And again, each manifold has 4 ports. So if you're using both canisters, you have a total of 8 ports. This is also designed to be in the room between cases, so you're most efficient. So you don't have to wash this between every case, as long as you have enough volume left in the canisters to be used. So in order to do so, you would just press this button here. It says reset volumes. It's going to prompt you to confirm that. You confirm it, and that's going to zero out what you've used for that case, for the next case. So again, it's a closed system. You're not going to be exposed to the contents. So when you're done with the case, just discard this. You can keep the tubing on if you like or pull it off. And then for a new case, you just put a new manifold in and you're ready to go for the next case. I actually so this is good. I just got a warning here that said there's a used manifold. So it will prompt you if you're using the same manifold that's been used before. And any notification will come up like this little yellow triangle here. You can also have the option to dump the 4-liter canister into the 20-liter canister. So just know that you're going to lose suction for 30 seconds, but it is an option to do so. If you're dealing with cases with a lot of irrigation, I would just say start with a 20-liter canister. There's no real reason to use the 4-liter unless you need extra capacity or if the anesthesiologist wants to use that canister for themselves. Let's see.
could reset the volume for the 20 meter too in between cases?
Yep, so this will actually reset the volume for both. So for the whole, unless you're only using, sorry, it won't reset it for both. So it'll zero out so it's one per case, and that's the reason why. Any questions so far? Good. All right. Now, also this eyebrow will give you an indication of, if you're across the room, for example, where the suction level's at. So if this was turned and you don't have an indication, this is green for low suction, yellow for medium, and it's going to be that orange for high suction. All right, so let's go to something unique about the Neptune is you have built-in smoke evacuation right here. So this is an ULPA filter. Inside the Neptune, you also have a HEPA filter. So anything going into the manifold is going to be HEPA filter. Anything going into the ULPA filter is going to be ULPA filtration for smoke. So manifold liquid, this is smoke only, no liquid in the ULPA filter. Just so you can get a reference, this ULPA filter is 100 times more efficient than the HEPA filter. N95 mask, 95% efficient. This is 99.999% efficient in terms of capturing particles, down to 0.1 micron. Again, for your health, this is for smoke. So, when you're using this, so this will tie into the generator just like any Bovie. There's 3 ports here. You have 7/8, 3/8, and a quarter. So this pops right into the 7/8 port. And in order to start this, you just click evacuate smoke. And then there's 2 options. You have on and auto. So on is going to be on consistently. So if we turn that on, it goes on right away. The whole point of smoke evacuation is to evacuate the smoke. So I would recommend you put it on and keep it on. Auto is going to be like a smoke detector in your home. So it's going to sniff for smoke. When it detects smoke, it'll evacuate. So as long as it's okay with everybody in the room, I would recommend just keeping it on. And then you can adjust the setting as needed. That's as loud as it will be. So that's at max.
When you have it on auto, does it when you use the Bovie itself, does that when it starts to suck?
It will, like I said, so when it detects the smoke, it'll suck, but there's going to be a little delay on that. So that's why I would recommend just at the site evacuating that smoke and keeping it on. Again, if there's any issues with noise or anything like that, you could always dial it back, and then you can see the efficiency of that smoke evacuation. And you can also use, we've seen smoke tubing put in here, we've seen obviously Bovies, so whatever, maximize this as much as you can. Again, this is very important for your health. I know I passed around a flyer, and there's over 150 harmful chemicals in surgical smoke plume. It's the equivalent of smoking 27 cigarettes a day for an 8-hour shift. So this is really something. Advocate for yourselves. Use this, and if it's expired, switch it out. And I'll show you how to do that right now. So.
Could you pass the Bovie itself around?
Sure.
Will there be a Neptune in every room now?
Wherever you want to start. There should be a Neptune in every room.
How often do you change the filter?
Yep, so the filter is 80 hours. There's 8 hours of life, and it's very easy to change. So all you would do is pull this out. If you have a new filter, you would actually date it. So it's just good practice to date it to know when this was put in. And you slide it right in. And if you notice, this isn't flush. It's not supposed to be flush. This is how it's supposed to be. So you don't have to jam it in. It's really gentle. Just push it right in. There's a sensor in there, so we don't want that to be damaged in any way. And then you would come into this menu, into the settings. So settings, you go to accessories because it is an accessory on the Neptune. And then you would press reset hours here. So to answer your question, 80 hours of life for the Ultra filter.
So when you put in a new one, you reset.
Correct. And it will count down. So it's gonna count down from 80 hours as it's being used, and then it'll give you a warning saying that low life on your Ultra filter. In the same way, it'll give you a warning, low life on your HEPA filter. The HEPA filter has 500 hours, so that's gonna last you a very long time. As the usage of smoke evac increases, just keep an eye on that Ultra filter.
But have you used this one on the street accessories?
Accessories.
Oh, yeah. So I'll go back here. So this is the main menu, settings,
Settings.
accessories, and then it'll give you those filters. So if you just click smoke, if you click evacuate smoke, that's just a call to action. So it's going to be, that's to turn it on and off. The settings will allow you to reset and see how many hours of life are left.
Now, when the filter is disposed of, since it has all of these contaminants in it, should it go in a red bag?
Yes, should be red bag, and then again, just put a new one in, just like that.
Is that
Let's see.
section 40 the only one that's compatible to the Neptune?
So the other ones may have like a 7/8 port as well, which you can obviously fit in here, but you know,
Does it read it the same way?
it will evacuate the smoke, but we gotta understand what's the goal here. The goal is to evacuate as much smoke as possible. So I would recommend using what's designed for this machine, and being most efficient with that. You know, even down to it sounds silly, but the bogey you're passing around, I mean, there's hours that go into the design of that. There's hours that go into the design of that.
Many of the surgeons who don't want to use the present smoke evacuator bogey that we have find it that it's too bulky in their hands, and if they're using it for an extended period of time, their hands will cramp. So, and smaller
Right.
elderly people don't want to have, because it was a bigger profile. I haven't seen this one yet, but they didn't like using it.
Right,
I know.
and that's something I hear quite often.
Thank you.
Surgeons tend to really like this one. It's very light. It's more
They used to have
ergonomic.
this thin pencil bogey, that's what they like.
Exactly. So, and that has all different kinds of attachments
We
and
can
things.
switch the tips on these?
Yep.
So
All
there's no connector between that machine and the Bovie except the tubing?
just the tubing, yeah. And then it obviously has to plug into a generator for the power. And I will actually pass it over. These are some of the tips that you can switch out, just if there's a preference per surgeon.
Excuse me,
Yeah.
that filter, that
Yes.
entire piece gets disposed of, or is there a part inside of that comes out?
This entire piece comes out. So you pull it right out, red bag, and put a new one right in. And date it like I mentioned.
And as far as the other holes, do we sell other tubings to go with it, or?
Yeah, so we have 3/8 tubing, 1/4 inch, and we have 7/8 tubing as well. So if you wanted to, say, evacuate the smoke at the site, maybe if you're using multiple bogies or what have you, you have that option as well. If it doesn't fit, we have adapters, and we also have like you can also use like a Christmas tree adapter to get to this.
And can you use one of those, more than one at the same time?
Yes. So this is designed to use all 3 ports at the same time, if needed.
Can I interject?
Of course.
One thing we noticed is that this pole goes up and down in a piston type of formation. This is made of aluminum, and during cystoscopy, most of the times the fluid warmers are screwed on to this housing, and it's causing dimpling of the cylinder here, and at one point it will dimple so much as to not permit the piston-like effect of this going up and down. So my suggestion is, instead of attach, you can see the dimpling here already. My suggestion is to attach it to an alternative device such as an IV pole, because sooner or later this is going to crimp this pole and will prevent this pole from going up and down.
What if we put that sticky stuff on top?
We
Just
can
put
maybe
it to
put
sit on.
Velcro, like I've seen that where there's Velcro on the bottom of the fluid warmer and then a Velcro piece on here and we just rest it on top right there.
I think,
Maybe David, you could test that inflow along the mood, can get some Velcro on the fluid warmers for here.
let's drop it down.
I'm gonna give that a try. Then you can just, if you ever had to if you have like a large volume case with a lot of fluid, you can just transfer that warmer right onto the next Neptune if you had to switch it out.
Do we have this product now, Dana?
I'm sorry?
Do we have the smoke evacuator?
We do have that. Yes.
And also, I don't know, do you take
One for each.
specimens often? Do you have specimen collections?
I did
From
yesterday.
section? Okay, so just so you know, we have a manifold that's just like this. It has a blue cradle though, and that's specifically designed for specimen collection. So, you know, you can use suction and pop this off and then obtain your specimen as well. So if that's of interest, I could bring some of those in as well, if needed. Any other questions?
I might have missed it, but this just goes into a regular Bovie generator, right?
Correct, yep.
And how easy is it to, as I saw in the pamphlet, the different tips that you can get for it, how do they exactly come off of what you have to put on another tip?
So here's the tip. There's a smoke sleeve as
And
well.
that's a coated tip already?
This is a coated tip, 70mm coated tip. This is a smoke sleeve. This comes off. We have different sizes of this as well. So if you have an extended tip, we have an extended sleeve as well. We also have a shorter sleeve than this, so about 50mm. So if there's any objection with their vision or their point of view, we can have a smaller smoke sleeve there, and the tip comes right off here.
Yeah, clamp.
So this will come off just like any other tip.
Also with the ones we were using prior, the slide suction thing would often suck up the tissue that's around the area, and so they even if they had the extended tip on, they didn't want to extend the suction because then it was just getting in the way. This might be a little better to not suck it up.
And we also have a Bovie that extends as well. So if that's of interest, I can bring that in as well. It's really all about preference. It's a little bulkier, but it does give you that.
The other one. It's a much
This is much more ergonomic for sure. But the extended it's like basically an extended shaft that comes out, so you get another 8 inches. But again, we have the extended tips as well. And then there's options for a rocker switch like this or a push button switch. So that's just preference. Again, I can't speak on what's preferred from a surgeon's point of view, but I will say that the rocker switch is more popular.
So I didn't really get to preface it too much, but this was for Dr. Sagal, part of his preference as he was joining us. So I don't know if this is going to be like mass distributed for each case, but we're starting with the Dr. Sagal. This is preference, and maybe it'll catch on to the other surgeons eventually.
because then
Because it seems like a nice product. It seems a little bit more comfortable than that big Davidian one.
Because then in each of our custom packs, they can remove the Bovie.
Yeah, they could do
Their
that.
most common complaint is the bulkiness.
Is the bulky,
Yeah.
yeah.
And I can understand why surgeons don't want to use it, especially in like a finer procedure or like a
It's just that their
plastic
hands
case or
get
something.
tired.
Yeah,
It's more to hold.
It's definitely sleeper, but just so you know, this is not like going to be like mass introduced to all the cases just yet. I don't know, maybe going forward, but
Because it's more of a procedure following down the hill. Because I know when we've had other nurses come from down the hill up to here, they're like, oh no, we use the smoke evacuator Bovie on every case. The
Yeah.
surgeons always use it. You know,
they should
here-
be used on every case.
Up here we're not, because if we have our custom pack and it comes with the regular Bovie, and that's what everybody gets.
Yes, so eventually I'm sure it'll transition to something more similar to this. I don't know.
And some of the bigger cases we have, you have two Bovies going.
Yes,
Can you-
yes. So
So if you
we'll
have
see
two
what, we're
Bovies
gonna see
going-
what happens down the line with these.